And I got to tell you, it's very difficult because, you know, prostate cancer, or even prostate screening per se, in the best of times, with the best group of people out there, it's a little bit controversial. You know, like somebody's always after me to get my PSA check, and of course I say no. I don't want to know.
One of these days.
Yeah, one of these days he's going to stick me with a needle. But yet in communities like the African American community, the Latino community, prostate cancer is statistically perhaps above average from the rest of other folks. Can't get the message across because of the different cultural taboos. What do we need to do to bring it to that level where you know, oh, I'm 50 years old, I have to see one of you guys, and it becomes like I'm going to my dentist for an annual, you know, dental checkup.
Well, nobody looks forward to a prostate exam, or, you know, with hearing about some of the complications that may even come about from treating prostate cancer, losing one's sexual function. You can see why there's a lot of apprehension out there. And it's not even just these ethnic groups. We even have a story about a gay couple in here, and that is even perhaps even you know, a greater example of taboos with regard to possibly tampering with sexual function there.
Right.
But I think the point is we need to create better awareness, and the alternative, which is to succumb from disease, is certainly not an acceptable one, I think. And what we try to tell in this book is that you should move forward, recognize that with our proficiencies now, with various robotic approaches, open surgery approaches, even radiation therapy approaches by the very best experts, outcomes can still be very, very good. But at times, if there are outcomes where there are challenges with sexual function, urinary function, we have also options to address this. So life is not over, and we can restore quality of life and make sure life is worth living. After all, if you're not here, you can't have any kind of sexual function. You got to be alive.
You got to be in it to win it.
You got to be alive. So we try to convey all of these messages in this book.
I think what you just mentioned is actually very critical, because there's never the same treatment correct for every patient. So the whole art of medicine, exactly what you said, is to read these stories and really find out which treatment option is important for that particular patient. And as you mentioned, the outcome is excellent in the hands of the best radiation oncologist or the best surgeon. Whether it's open and robotic surgery, we have this debate all the time, but it's finding the right person that works for you and has good outcome that's really important. In the African American community, one of the biggest problems that I have is really get these guys to go for that initial, even digital rectal exam. And as you said, it's not fun. But I think more and more...
You guys have to come up with a better screening tool.
Well, look, PSA is a great test, even though it has its own issues. But, you know, I think digital rectal exam is, in this political environment, is cheap, it's safe, you're not hurting anyone. And we just have to change that culture. And I think, you know, we have a lot of work to do, especially in the minority and African American community. Just don't go for the testings. It's a big taboo, and they're not.
Right, because the problem is really severe in trying to get the message out. I mean, programs like this help.
Right.
And I think also they have these programs called the barber. How is that phrase? It's like you go to a barber shop, and they're training barbers to be able to discuss prostate cancer with their customers.
Right.
And we need better outreach programs to reach into the community.
There's no question we need a bigger voice. I think, like, we started the support program just like you have at Hopkins. I started it at Mount Sinai, and I can tell you that the first session we had about 200 people that attended. We talked about prostate cancer, the new technology, robotic surgery. In the last year, the numbers have gone down to maybe 20 people. These are the same guys that you see all the time. And I think the whole old-fashioned support groups are actually quite boring. And it almost like looks like you're going to die, you're going to be incontinent, you're going to be impotent. And I think the biggest message from a book like this would be that there is life after prostate cancer, that you are going to live, you are going to have a good quality of life, and you can make comments on that.
Absolutely.
You don't have to be in diapers all the time. And also, not every prostate cancer is that slow-growing disease that you can just watch and wait. There are some aggressive cancers that you have to address, either with surgery or radiation, and I think all of those are hopefully the points that we can bring up.
Well, let's face it, prostate cancer does claim lives. It kills men.
Yeah, it kills men.
It faces 1 in 6 men in the United States. And we know that second to lung cancer, it is among malignancies in many of the United States, it claims lives among cancers. So there's no doubt this is a serious disease, and just hiding from it, putting your head in the sand is not I think, a tenable.
It's going to get worse with the boomer generation.
So I think that we need to create better awareness. We need to get into our communities, and as we're echoing here, yes, there are potential situations, complications, but we can address that.
Yeah.
And we have technology. We're improving all these areas. We need to keep preaching and teaching this message.
I'm glad, again, we're talking about the book is Prostate Cancer Survivors Speak Their Mind, written by Dr. Burnett and Norman Morris, who is a survivor himself. I'm glad the dialogue is leaving the doctor's office a little bit, because I think that one of the primary problems, and this is just my editorial comment, that has happened to America in the last maybe 10 or 15 years is that we doctors have become so much subspecialized, and we had to perfect that subspecialties with technology and surgery and radiation and things like that, that we have forgotten about preventative health care. And preventative health care, for lack of a better word, is education, reminders, building consciousness. Primary care doctors, I remember, I run one of the largest OBGYN departments in the country. And I remember getting a scathing email from years ago from a primary care physician to remind me that none of my obstetricians were doing rectal exams. And I said to myself, gee, that's right. I mean, when do we do a rectal exam anymore? We, do vaginal examinations, we do pap smears, but no, but a rectal exam years ago was part of the physical that a woman gynecologically will get. And you can identify whether she has any rectal cancer or abnormal lump. And then you say, listen, you have a lump there, go see the rectal guy. Right. But we don't do that anymore. Now, they don't do it because they don't want, again, maybe they don't want the liability. If I don't do it, they won't ask me. I don't want to get, any kind of commentary about inappropriate examination that I shouldn't. I mean, all these sorts of taboos that are sort of built up in the subspecialty areas has led to a lack of communication. And this book now is being presented by patients. I think it's going to do a lot of good for a lot of people.
Well, no doubt. There's books out there for breast cancer. There's books out there for diabetes about patients telling stories. I think this is really a new one, and hopefully it's one that help patients come out of the closet, come out, speak about things. Prostate cancer is such a tough subject, so let's hope that
they listen.
One of the other things I wanted to mention was that I deliberately wanted to be able to reach men, whether they were very well educated or whether they didn't complete graduate school. So the idea was to take these complicated issues, these complicated subjects, and write it in conversational way so that everybody can understand exactly what's going on.
All right.
Wonderful.
Well, I thank you both for coming to the program.
Thank you for having us.
Again, the book, let me give another pitch here. The book is Prostate Cancer Survivors Speak Their Mind. It's written by written by Dr. Burnett and Norman Morris, as I mentioned to you before, who know a lot about prostate and surviving prostate. There's a wonderful story, so everybody should get it. This is a wonderful gift to give, especially for people that are suffering from prostate cancer, or men like myself that are too stubborn to get their prostate checked. So learn something. It's 41 minutes after the hour. Let's take a break. When we come back, we're going to have Dr. Alan Katz, radiation oncologist, to talk more about prostate cancer.